Learning so many things. I'm just writing down notes and questions for everyone. If you're online and you're sending in your question, please do tell us who you are, which hospital you're from, so we can have those questions and answers. So this one, first one, Prof. Dr. Park, are you there? Are you online now? Can you hear us? We have a question for you all the way from Malaysia, from Emmanuel Fong. Can you hear us, Prof. Park? Can you unmute him? Maybe? We'll see whether we can unmute him. So this is the question for you. Has the establishment of Conflict Resolution Act reduced any in-court litigation or costs? Would you be aware of this? And after Dr. Park answers that question, I may also share it with Dr. Chi, all the way in Singapore, and our in-person experts here as well, to hear from different countries so that people who are listening in will have a better understanding of it. Can we get Dr. Park?
We will catch him very soon.
Okay, no problem. So, Dr. Chi, are you there? Do you know whether this establishment of conflict resolution has reduced in-court litigation or cost at all?
Okay, so in Singapore, we have a mediation process, right? And you are asked to go into mediation before a litigation. And definitely the mediation process has, I think it has saved a lot of legal costs, time, and cases that are mediated and do not progress to the courts. So I think conflict resolution is basically like mediation, and it does have its usefulness. And in general, it closes cases faster at a better rate. In other words, the patient gets a resolution rather than all the costs going to every other direction except to the patient.
Okay, good. Good to hear from you. I'm going to go to Shan after this, but just to elaborate for Emmanuel as well, I think it's just more than money, because what we're talking about is an intangible in its trust, in the transparency and the trust of the facilities that patients go through to get healthcare, right? So that intangible is not in money, not in time, but in lives. And the trust that person has is when the hospital or the healthcare facility or the system happens to answer back as quickly as possible. People know that no one is hiding anything, right? So that means you're confident of your product because you have answered quickly enough. Dr. Shan, maybe you want to jump in on that?
Hi. So in Malaysia, in our private healthcare regulations, we already have stipulations where the hospital has replied to grievances or complaints which are raised. So that's where in terms of complaints which are raised. But I think from what he's asking is in something similar to what we have in Malaysia for protection at the hospital when we report sentinel events or serious events to the Ministry of Health. So this gives the hospital some amount of legal protection that the contents of these investigations are not discoverable in court. Because, of course, as healthcare providers, whether you like it or not, in today's current healthcare setting, litigation is always at the forefront of every incident that happens. The first thing everyone is looking at is that part.
Right.
But, of course, we want to give the best for our patients to give the safety. So in Malaysia, we have that. That's already been protected. And we do see hospitals coming up in front. I'm not just talking about private, even government hospitals. They are coming up and in front to share their learnings and open up about incidences that have happened. So that does help, definitely. But in terms of litigation, I think I would agree with how Prof has mentioned. The mediation processes are there, and that does improve things as well.
Okay. Have we got Prof. Park back? Have we got him back? We're still trying to connect with him. No problem. Have you got any thoughts on that, Dr. Chu? Yes, has it reduced at all?
I think it's just very difficult to estimate the cost that we save, but this is the life and the whole family,
right?
And the whole thing, yes. Yeah. So this is more than the cost like you're talking about. There is a trust, yes, the trust in the safety that we can get from doing the patient safety policy.
Sure. We've got a question for you now, Dr. Ong. If we get Dr. Park, we'll come back to that question again, Emmanuel. Dr. Ong, how do you implement KPI for hospital staff when they have resistance to use the system or to report it? Doctor?
Yeah, okay. So I think it is two different things, right? In fact, the first thing is culture. You need to build trust, you need to build culture, which is why I shared that when I first took over and the hospital already had a KPI of incidents per 1,000 patient days. The first thing I did was I said, okay, let's make it 10 times more, right? It is just to send a message that we know things are happening and we would like you to report. So I think the KPI is actually not the first thing you want to work on. The culture is the first thing you want to work on, right? Do people trust you? Will they sort of feel that if they report something, you won't go after them or after their department, but you are serious about improving the system?
Okay.
I hope that answers your question.
Well, I hope it does. I have got an additional question for you. Just now, during your session, you had mentioned that you are not very much in favor of the no blame culture, right? Could you expand on your reasons why?
Well, okay, I guess it's a fine line between no blame and a just culture. In a no blame culture, it almost assumes that whatever I do, okay, I decide today I'm going to come to work drunk, okay, and then okay, that's extreme, but let's say there's a policy that you should do something or other, and I decide, well, I'm smarter than the policy, I shall not do it. So I think these are open violations which one must be responsible for. And I think as an organization, it will be very difficult if we sort of tell people, oh, you can do whatever you want, we are not going to blame you if something goes wrong. And we can't answer to our patients. So this is different from a just culture. In other words, you do have to follow certain rules and certain accepted behavior. So there is a process, a decision process, right, where we will look at your personal accountability, right? So that is a just culture. But for example, there is a policy that says you have to check, before you give a drug, you have to check 10 times, let's just say, right? And you know that it cannot be done. Then certainly we are not going to blame you either if you bring it up and say, look, this is ridiculous, it really cannot be done, right? So I hope I'm sort of, differentiating between a no blame and a just culture. We definitely support a just culture.
Okay. Dr. Shah, I'm going to go to you because you were talking about a just culture. What are your thoughts on what?
I think I would definitely echo what Dr. Ong had mentioned. In terms of reporting or setting KPIs for incident reportings, that isn't what we are looking at. Like what Dr. Ong mentioned, it's purely about setting up the culture of openness to reporting. Because unless reports are raised, things don't get addressed. So it's that safety, mental safety, the staff and team needs before they're able to raise things very transparently. Like what Dr. Ong said, probably 20 years ago, you would be having maybe 100 incidences, but only 6 are being reported because, like what she said, those are the ones that you cannot run away from. But today, I think with where we are coming from and giving more security to our team, that mental security, they are open to reporting things. So that's where just culture comes in, where when an incident is raised or identified, we are not going to go and pick on the individual errors mainly. Of course, we would do an RCA, and of course, as part of a just culture, there is a certain amount of accountability on the individual. But when we do the RCA, we don't just do something at the surface level, we go deeper. Sometimes the system is already inherently flawed. I mean, healthcare is constantly evolving, so when a system is old, there are risks for flaws there. So that's where we want to fix it. So these incidences and the just culture then comes in there.
Okay, I'm going to go to Dr. Chu right now because it is connecting. All this is very much connected, right? In your presentation, you were talking about the app, the real-time app, that you have on the number of beds, ICU beds, and you're talking about ICU beds without a wall, right?
Yes.
And you're working on that. Now, you have an app, and
Yes.
you had a system, and you have 3,000 people who have used it, right?
Yes.
Since now, let's talk about that app right now, and the system that you all have created. How long did it take you to implement it, to teach the people who are going to use it, and to deploy this so
Yes.
that it is that successful?
Yes. This is how long to develop is not so long, about the 3 months, but when deployed, this is take a time. And we have the key message to you can implement it faster. Is one, you must to do it at the top-down policy. If the top-down policy, this is the policy, everyone can engagement more faster.
Yeah.
Yes. But it's the bottom up is slower. It's only someone who want to use, they don't want to use, then cannot do that. And every time you request the best ICU based reservation, and I think that's if you got the best for your patient, that is your reward.
Right.
Yes, and the system serve that.
Okay.
Serve that if your patient got a benefit to ICU, I will find the best for you. And I will tell you that's the first. We not build any new base. Yes,
Okay.
ICU without one is without the
Yes.
destroy the wall and build a new bed. No, not. We just only the organized. We organize. How we can organize that? We know that any bed, which one can we go out to the ICU? We will run down the SOFA score. There's a prognosis score. Who is the better? Who is the best case today? Who can go out? Who must go in? Yes, like that.
Okay, that's great. That implementation of these systems today, very important. And we're going to go to a question online. Do we have Dr. Park? No.
He's not back in here. We have
Okay.
2 more questions.
Okay, Prof. Ong, this question's for you in Singapore. How was your experience in moving from a no-blame culture to a just culture? And were the leaders and department heads receptive to these just culture principles?
Okay, so it is a move, and I think we, of course, had to again engage people right from the top, right? And I don't think we had a lot of problem, convincing people that the just culture is correct. The only problem, of course, is you do need to work with your HR because, in certain domains or disciplines, I think the hierarchy is much stronger, right? The blame and you take responsibility sort of way of doing things is a lot more prominent in some domains. So I think that takes quite a bit of training and also working with the ground staff, right? So you find that your leaders are very easy to convince. Okay, so I'm talking about, let's say, the heads, the CEOs, they're very easy to convince. The most difficult to convince actually are the middle rung, your managers, right? What we call the sandwich group, because they sort of feel that the leaders are holding them accountable to some results. And day to day, they have to function with things that are happening on the ground, short of staff, people who don't follow orders, so on and so forth. So that actually is the group that is the most difficult to convince that the fastest way to solve a problem to them sometimes is to knock you on the hand and then say, don't do that, okay, that's it, end of story, right? But that training takes time, and like I say, I gave the example of you do need someone influential among themselves, right? You need a thought leader among the group that is maybe difficult for you to handle to just come forward, right? And say that I support this and I think it's right. And then the battle is won, right? Someone from outside. So for example, if I say top down, okay, we are going to practice this, it won't work. Okay, people on the ground trying to do it. Yes, if you have 1,000, 10,000 people who believe in it, perhaps. But in general, the ground also not easy for them to push a just culture, right? So I think it is something that you do need to get buy-in from a few influential people, and then get them to help you change the rest.
I think the word culture itself takes time to build, you know. It doesn't happen overnight, you know. System processes, you can put it in place and you can say this is how it's going to work from today onwards. You know, we've seen all our countries try to implement GST and SST and say, from this date onwards, that's how it works. You like it or not, that's what happens. But with culture, it takes time. It takes time to build and to trickle down to people in various sectors. But I hear what both of you are saying here, that you start from the top and it really trickles down, you know, so the people at top really need to buy into this. And I just want to allude to a point that you made just now about the number of patients that are coming in now. According to WHO, world population is at 8.1 billion, and healthcare people who are in healthcare, doctors, nurses, radiologists, attendants, anyone who is in quality assurance, everyone in hospital, are only 65 million. So there's 65 million people in the world in healthcare taking care of 8.1 billion. That is 0.78% or something like that. Now, I can just give you the facts. In Malaysia, our population is 32 million. Our healthcare staff is 350,000, private and public, right? So you're talking about a huge gap to connect with. If you don't integrate your patients into the solution, then you're left to do this by yourself in a very silo way. Because if people in healthcare facilities think that I'm taking care of the rest of the country, and this is the system that you get, without integrating the person who needs that help at the end of the day, that's very important to integrate them, right?